Hey everyone, this is Emma. So I wanted to talk to you about something quick that I should have recorded a video about a while ago, and I've been meaning to, but as I keep saying, the news keeps coming so fast, and it's really hard to stay on top of things, and I keep having ideas that I want to dive deeper into, but can't find the time. And this is one thing that I don't want to put on the back burner. So I'm going to take you right over to this first article. I'll start it off with this article that was in The Week on March 11th. So that was last week on Wednesday. A Seattle lab uncovered Washington's coronavirus outbreak only after defying federal regulators. I was really excited to find this because it kind of confirms some things that I had seen in looking up the flu data from Washington from basically this entire flu season. And it was just something that I kind of found on my own and showed to people, and people seemed to understand what I was saying. But this is the first thing that kind of really drives home the fact that this has been here for a while and there's more going on than we probably realize. So in Seattle, Dr. Helen Chu, an infectious disease expert who was part of an ongoing flu monitoring effort called the Seattle Flu Society, asked permission to test their trove of collected flu swabs for coronavirus. Now, this was back in February. State health officials joined her in asking the CDC and the Food and Drug Administration to waive privacy rules to allow clinical tests in a research lab, citing the threat of significant loss of life. The CDC and the FDA told them no. So these people, obviously, if they're working in the Seattle flu study, they've been paying attention to what's been happening in China, and they probably had the same feelings that some of us have had. We see this bad thing developing, and it's starting to spread to some other countries, and it's probably, most likely, on its way to the United States. So what can we do now to see if it's here, to start to prepare? And she told the Times, she told the New York Times, we felt like we were sitting, waiting for the pandemic to emerge. We could help, but we couldn't do anything. They said, we have the ability, we have these flu swabs, we would like to test to see if coronavirus is here. The CDC and the FDA in February told them no. And so, these people held off for a couple of weeks. But on February 25th, Chu and her colleagues began performing coronavirus tests without government approval. So they waited 2 weeks, and then they decided to do it. Even though they didn't get updated information, the last thing they had heard is no, but they decided to do it anyway. And as soon as they did it, they found a positive case pretty quickly. It says after discussing the ethics, they told state health officials, who confirmed the next day, that a teenager who hadn't traveled abroad had COVID-19. And the virus had likely been spreading undetected throughout the Seattle area for weeks. Later that day, the CDC and the FDA told Chu and her colleagues to stop testing. They partially relented, but then the lab continued to test and they found several more cases. On Monday night, they were ordered to stop testing again. Now, February 25th was a Tuesday, so I'm guessing that maybe that was Monday, March 2nd, that they were told to stop testing. We did hear a few days into March, I don't remember the exact date, that there were some deaths in Seattle that were retroactively added to Washington's death list. We didn't find out how or why those happened. We just found out that 2 deaths had happened back in, I think, late February, and they were then being added into the total deaths for Washington. It's a chance that those cases, those swabs, found those positive cases and found out that those people were dead. And then because they had that information, they had to report it. I don't know. That's just speculation on my part, obviously. So around the same time as this testing was occurring, there is this article back from March 12th in the Seattle Times. Amid the first signs that the novel coronavirus was spreading in the Seattle area, a senior officer at the University of Washington Medical Center sent an urgent note to staffers. The note said, "We are currently exceptionally full and are experiencing some challenges with staffing. He also noted that staff should try to expedite appropriate discharges ASAP. That generally means that they need more beds. This note was on February 29th. That is the same day that health officials in King County announced the United States' first death from coronavirus. Now, it seems that these two things are probably connected. We've heard a lot this year. We hear this every year, though, that almost every year, that the flu season this year is particularly bad. Everybody make sure that you have your flu shots, whatever. That's something that a lot of people probably don't pay attention to because we hear it every year. And some people think that maybe they're just saying this every year because they want us to get our flu shots. It's something that we don't pay as much attention to because we're kind of bombarded with the same information about flu season, flu blah, 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 flu this, flu that every single year. But I wasn't even paying attention to myself, but some people brought up, they've been saying that this has been a really bad flu season, that there's been more deaths from the flu, more pediatric deaths because of the flu this year. Could that somehow be related to what is going on here? I don't know, but let's look into it a little bit. So I looked up Washington State's influenza update. Every state releases weekly reports for every week of the flu season about what exactly they are dealing with. Now, it was really interesting looking back at this article that this note was written on February 29th. The first death was announced on February 29th. And I came over here, and it happened to be on February 29th that I looked up Washington's flu statistics. Now, that was for week 9. Right now, it says week 10. Ironically, week 9 until today had been the most up-to-date flu report from Washington State. These are supposed to be released weekly. It's not still week 9. Week 9 ended on February 29th. So it just so happens that I thought to look this up on that last day of week 9. And then I kept checking it. And then I kind of forgot about it for a while. And just 2 days ago, I went back to look at it again, and it was still on week 9. It was still the week ending in February 29th. They had not updated it until apparently today, which is odd because I just went to go look at this again, and I'm like, oh, it's week 10. Interesting. So I went back through and I checked to make sure that the information that I had seen in week 9 that was kind of startling is still the same in week 10, and it is. So that's good. But I wanted to show you the specific thing that stood out in this log of weekly flu information from Washington State. Now here, I can start by showing you I'm in this section for influenza-like illness. Now, influenza-like illnesses, actually, there was another state that described what influenza-like illnesses are kind of nicely, so let me find that and read that to you. On Michigan's weekly flu report, they say, for this system, ILI, which stands for influenza-like illness, is defined as fever, temperature of 100 degrees Fahrenheit or greater, and a cough and or a sore throat without a known cause other than influenza. This graph down here is the one that I found most startling. In figure 9, you can see 2015, 16, 17, 18, 19, 20 for diagnosed cases of the flu. 2019, that season, and it's March here is the tick mark in the middle. 2019, there was more flu cases, positive specimens there. In this next graph, we see the percentage of visits, so these are hospital or clinic visits, for ILI, influenza-like illnesses. I see a very low graph here, and blue is the seasonal baseline. The dotted line is an epidemic threshold. March 2015, pretty low. March 2016, lower than the epidemic threshold. March 2017. It looks like maybe January or so, one dot, 1 week above the epidemic threshold. That's what each dot means. It signals 1 week of the season that was above the epidemic threshold. 2018, there's more. 2019, there's only 2. Look at 2020. So that is this flu season, and this tick mark right here is March. It's a little hard in this graph because it's so compressed. But if this dot right here, I believe, is March, so we can step back, and if you go through each dot and you go up here, look at how many visits there were at the end of 2019, earlier in this flu season, that were at the epidemic threshold. And down here, this is a sharp rise all of a sudden. And compare this to the previous years, all the way back to 2015. There's nothing like this. That looks like, as soon as I saw this, I thought, has the coronavirus been here for a long time? And we don't know? Because what explains this? We are being told that the flu is worse and there's more flu cases happening this season, but this is not the flu. This is something that is flu-like, but not the flu. Wow. That is super significant to me. So I kind of put that on the back burner, but I started thinking back when I looked at this on February 29th, does this mean that this has been here for a really long time? And now we know that it has been here for longer than when we first started seeing cases. They first started telling us that maybe it's been here for 6 weeks. If this is any indication, I think it's been here for longer than 6 weeks. But looking at this, and this is probably stuff that the Seattle Flu Society was aware of, or the Seattle Flu Study was aware of, and their desire to to test their collection of collected flu swabs for coronavirus, and the fact that the CDC and the FDA said no, despite this being a thing. So if we take a look at an article from local Seattle news, just talking about the flu season, this is something that has been consistent pretty much all over the country. The flu season is peaking earlier than normal this year, and more deaths have been reported. They're encouraging everyone to get a flu shot. They say the H1N1 swine flu has returned along with other strains. They say we've got an unusual return of the H1N1 pandemic virus, which tends to slam our young working age adults and middle-age adults a little bit harder than a typical flu season does. King County has seen dozens of people hospitalized because of the flu, and they discuss the number of deaths that have happened because as a result of the flu. So again, I was looking at this data showing that there's something going on in Washington that is not the flu. It's just an influenza-like illness. Coronavirus is a little influenza-like from what we've heard. People are still calling it the Wuhan flu. People are still referring to it as a flu, which is incorrect, but that is because there is a crossover with some of the symptoms. But there's also been, not an absurd amount of flu cases if you look at the positive specimens here, but they're saying that it's bad this year. They're saying that it's peaking earlier, that there's more deaths that have been reported, but I'm actually not quite seeing that here. But that led me to ask the question, is it possible for people to have the flu and have the coronavirus at the same time? There's lots of things that we can have two things at the same time, a primary infection, a secondary infection, co-occurrences of something. So it's not out of the question to think that this could happen. But I just did a little simple searching for things. And I looked at the human coronavirus. Yes, this is Wikipedia, but I just trying to get information as quickly as I can find it when I'm trying to connect some dots here. And so I looked up this coronavirus that was identified in late 2004. And it says it was identified in late 2004 in a 7-month-old child in the Netherlands. And it goes on to explain things about this virus. It's primarily found in young children, the elderly, and immunocompromised patients. So I found my way to this Wikipedia article because my question was, is it possible to have the coronavirus and the flu? This is speaking of the 2004 coronavirus that was discovered. There could be things that are different about different strains of coronavirus that makes it not possible to have co-occurrences in the same way that this one does. I don't know, but I found this interesting and significant and I guess kind of obvious. Many studies have reported the co-occurrence of that particular strain of coronavirus with other human coronaviruses, with influenza A, with RSV, with the parainfluenza virus. So knowing that, and now seeing the way that we are dropping the ball on testing in the United States, and in the limited testing that we are doing, we're often doing a flu swab before testing for coronavirus. If somebody is positive for the flu, they are not moving forward with the coronavirus test. That seems to me very irresponsible and very dangerous, and is not going to give us a clear picture of what is going on at all. So having found this, that co-occurrences are probably completely possible, and seeing this high rate of visits for influenza-like illnesses also made me wonder if this is something that we have seen maybe in other places throughout the country too. So I began looking up the flu reports for some other areas too. I looked up Minnesota because I live in Minnesota and we have a few cases here now. At the time when I looked up each of these weekly reports just a couple of days ago, today is Sunday, today's Sunday, March 15th. When I looked these up, Minnesota was the only state that had released week 10. Again, you can see right here, week 10 ends on March 7th. Every other state was still on week 9. And these reports are supposed to be released weekly. I can see that there might be sometimes a delay, but now we were at the point where we were weeks behind in every single state, and that seemed unusual to me. You'd think at a time when we're dealing with what we're dealing with right now that this information would be getting looked at and tracked even more so that these reports would be more important to release rather than not releasing them. Is it normal for some of these reports to be delayed? I don't know. This is the first time that I have I've looked these up, so that I could be completely wrong here, but I found it very unusual that I looked up a handful of states and every single weekly report ended on February 29th, except for Minnesota's. And so each of these reports are set up fairly differently. So I look through them to find the influenza-like illnesses. This is influenza-like illnesses by schools. Now here is the percentage of persons presenting to outpatient clinics with influenza-like illnesses. And you can see here, they say current week. And honestly, the current week, that dot is above week 9, even though this report at the top says week 10, but that would be over here. And technically we are at week 11 now. So who knows what is happening here. But I find it interesting that back at week 52, there is a significant spike, and then it drops back down again. If we go back here and look at this spike in Washington, and then it drops down and it comes back up again. Minnesota has each week down at the bottom, so this graph is expanded a lot more. It looks a lot different than how squished together, super squished together Washington's is there. Sorry, I keep pointing to my screen to look at these things, but I know you can't see that. I'm not used to doing this kind of thing on video. So that's what Minnesota's looks like. Here is New York's. The web address up here says flu report current week. So I would expect that each of these reports are just updated. It's not a different file name or URL here. Just the most recent report would show up when I go to that URL. And what we're seeing here for New York State, during the week ending February 29th. Today is March 15th. Where is the flu data between February 29th and March 15th? I don't know, but I would sure love to look at it. Let's see if we can find the influenza-like illnesses. Here we have two. It's a little bit different. Outpatient influenza-like illness surveillance network. So these are just clinic visits. We're looking at the dark blue line here. December 29th, we see a spike. It's not as high as some of the other places, but then it dips down again and it spikes back up again. So that one doesn't quite fit the same thing that we've seen in the couple of other places. Okay, Michigan is just showing us 1 year here. So we cannot compare to their previous years right now, except for seeing what their baseline is, which the baseline is probably calculated on previous years. It's got two different ways to track here, and they're both showing December 28th. Big spike, drop, spikes back up again. Okay, let's look at California's influenza and other respiratory viruses weekly report. Again, week 9, February 23rd through February 29th. Surveillance reports. Reports are archived by week ending date. 2019 to 2020 season. March isn't even in here. They have... It's way past February 29th. So this is the last report, again, that they've released on the flu information. And here is directly from the CDC in their weekly U.S. influenza surveillance report. Here we have week 10. Again, it's now week 11. Or right after week 11, so this ends on March 7th, but I guess that's a little bit better than the reports that have ended on the 29th. But let's see what the CDC says. There's this cool thing that shows we are in week 10 right now. Red shows us the high influenza-like activity level. Green is minimal. Let's take this back to the fall. Here's November. Green. Look at the red increase as we get into week 50, week 51, week 52. This is where I was finding lots and lots and lots of US states saying, wow, we have so much influenza-like activity. This puts it all quite clearly together here. There are no states that are just basic green minimal. There are lots of states that are all the way high, the highest of the high. And then it varies a little bit. It dropped a tiny bit and it went right back up to red. Some of these states never stopped being red. Wow. So after I saw this, my next thought was maybe if I look at the influenza-like activity coming out of China, is it possible that they will also have that spike and then a dip and then another spike in their graph of influenza-like illness visits, but earlier than the United States has seen, if we are following them in whatever it is happening with the coronavirus. And so I found the Chinese National Influenza Center. And what I found was that their last weekly report was also week 9, which I find very strange. But surveillance of outpatient or emergency visits for influenza-like illnesses. Now, it looks like there are other years that have been high for China in the past. But what we are looking at right now is red. Red is this year. Week 52 wasn't like their highest spike. It's over here, probably week 2. and then it dipped down, and then it went up really, really high, and now it's going down again. It looks like we're seeing a super similar thing for visits for ILI in South China. We've got that spike at the same time, a dip, a high spike, and it's coming back down again. Now, I did not, like I said, expect to see this same shape at the same time that we're seeing it in the United States. I imagine that coronavirus visits fall under influenza-like illnesses, especially before it was known that they were actually coronavirus. So seeing this shape here and seeing that shape in Michigan and seeing that shape in New York and that shape in Minnesota and that shape really, really significantly here in Washington is really interesting to me, because I would have expected to see China experiencing this before we saw it here. I don't know what that means, but I think it's something to pay attention to, especially considering that for some reason all of these weekly flu reports have not been being released on a weekly schedule like I would expect them to. And going back to this article where there were people that were more than willing and had the ability to test flu swabs that they already had in their possession to test them for coronavirus. And the CDC and the FDA told them no more than one time. And the CDC told them no even after they ended up finding a positive case. So I am just bringing this to your attention because I think it's very important to note that what I just said, that people in Washington state were ready to test for this and they were told no by the organizations that we are supposed to be listening to right now about all of this. That weekly flu reports from, I haven't checked every state in the US, but weekly flu reports are significantly delayed. Maybe there's a good reason for that. I don't know. If you know more about this than I do, because I know very little, please tell me in the comments. I would really like to learn more. Taking you back over here to the fact that there are reported co-occurrences between coronaviruses and things like the flu and RSV really drives home the fact that we need to be testing everybody. If people have the flu, that should not rule out that they might not also have the coronavirus. Does that mean that they will have a more severe case also? I think these are important things to pay attention to. I think that we need to go back and test any flu swabs that we can, that we have, that haven't expired, and that we go back and we look at deaths that have been attributed to the flu for this entire season. And I thought I would end by showing you this new article that was just brought to my attention from March 14th. So that is yesterday in Bloomberg. Flu watchdog spots more with fever and cough, but it's not flu. A U.S. disease surveillance network that monitors doctors' offices and hospitals has picked up a rise in people with fever and cough, but who don't test positive for influenza. It's not clear if the increase represents a rise in coronavirus cases that are being missed because of a shortage of testing in the U.S. It's possible that worried people with some other respiratory illnesses are showing up for care in greater numbers. But these people that would be worried about the coronavirus showing up in greater numbers now would be doing so now. Looking at all of those graphs, especially for Washington, it shows that people have been showing up at hospitals and clinics for influenza-like illnesses since before the new year started. Since the beginning of the flu season, this seems to have been a significant trend. Bloomberg says this is another piece of evidence as academics, public health experts, and the government try to answer what none know so far. How many people in the U.S. have been infected by the new coronavirus, and how fast is it spreading? The reports come from states as well as the U.S. Centers for Disease Control and Prevention's National Flu Surveillance Network. Along with people who test positive for the flu, the networks track patients who show up with influenza-like illness, defined as a fever of more than 100 degrees Fahrenheit plus a cough, sore throat, or both. Those are the same symptoms as coronavirus, as well as other illnesses. One analysis looked at data from the surveillance networks from the last several weeks and found an uptick in symptomatic people seeking healthcare but who tested negative for the flu. The trend was most pronounced in the Pacific Northwest, which includes Washington state. Now, this is saying the last few weeks. But again, look at this. This isn't the last few months. This is a while ago. But I'm so happy to see this in a mainstream article. I hope that this gets focused on. I hope that there's more attention on this and we start asking questions in our local areas about that bad cold that you had back in December, that thing that maybe you thought was the flu or you didn't think was the flu. I'm seeing more and more posts on social media of people questioning, was that bad cold I had? Could that have been coronavirus? And I think it's very important to answer or to ask those questions and to find answer for them, because in China, as China was fully immersed in this and dealing with it, some reports started emerging and anecdotal stories of somebody had coronavirus, they were cured, they left the hospital, and then they fell ill and they died shortly after being released and after being declared cured. Similar news just came out of Japan, and I think that they were just highlighting one case. I don't know if there's been more cases than that, where somebody who they thought was cured, who had been through the whole illness, and then came down with it again. As this was happening in China, there was some speculation that, is it the second time that you catch coronavirus that is the worst time? Do people catch it first and it's not a bad cold, and then you catch it the second time? And I believe people were suggesting that maybe the second time it would result in something like heart failure. I certainly don't know for sure, but I think it's really, really important for us to keep an eye on this. And if we can get some answers about if the influenza-like illnesses from earlier in this season were in fact actually coronavirus and why we were not allowing testing for this to happen earlier. On January 11th, China reported its first death from coronavirus. Back at the end of December, news started coming out of Hong Kong saying that they were screening travelers from mainland China for this mystery pneumonia that was kind of taking over. And they didn't think there was human-to-human transmission. They didn't know what was going on, but they were beginning to screen people. And then China reported its first death on January 11th. We know that the thing had been there for a while and had been getting worse before the first death happened. And then on January 20th, other countries began to confirm cases. So why do we have this huge lag in testing happening here in the United States, especially when there were labs in Seattle, where we now know it is worse than other places, was more than willing to start testing this maybe in January, but they're reporting that it happened in February, and they were told no. Why was there that huge lag when all of these public health people and all of these people who are, their jobs are to pay attention to this, probably saw things like this? Why was there a lag? Who dropped the ball? Why were we not testing people as soon as we knew what was happening in China? And especially as soon as other places began confirming cases outside of mainland China. What made that happen, and who would be responsible for that, and why would something like that happen? I think these are all very important questions to ask. I hope everything that I said here made sense. I was trying to connect a lot of different things and wanted to just get some of these graphs and strange things that I've seen in front of you guys. If any of you have responses to this or answers, like you are a public health, you work in the public health industry, you are a medical professional and you understand this stuff and I'm way off, or you have useful information for me, or you want me to point me to something else, please post a comment, send me an email, send me a message, whatever. I really want to learn more about this, and I definitely do not want to communicate things incorrectly. So I'm just showing you what I found interesting and what seems significant to me, and I would really like to know what all of you think too. So thank you for watching this, and I will put some of the links to some of the things that I've mentioned here in the description to this video if you want to check it out as well. Just stay prepared and do whatever you need to do to not panic. Thank you.